All right, I do apologize with that. There's only two more slides, this one and the next one after this, and I do want to bring home a couple of last points that I think are very important about this lecture here. So I was saying that food, whole foods, foods in their whole form, we know now, there's evidence that every single substance out there has certain types of antioxidants, polyphenols, phytonutrients, and that in their whole form, they can help the body support the body's ability to heal itself. And so, what I really want to finish off with here is just actually two more slides, this one and another last one. So, this is only going to take 2 more minutes. So, I apologize. But I think that because we're on a lecture where it is the new paradigm of looking at disease, of cancer specifically, is starting to see dietary factors through the epigenetics turning on of the oncogenes or turning them off. Food plays a major role. Please allow me to just finish with these two slides here. So as this slide shows you, there is tremendous amount, a lot of room for health growth. And as healthcare professionals, I want you to understand this slide and the next one. And this is coming straight from the CDC. The percentage of adults in the United States of America that are achieving the recommended dietary intakes of fruit and vegetables. And I'm probably guilty of this as well, but I'm aware of it, and so as I'm aware, I can make some changes and try my best to make the changes. But a lot of the patients that you are going to be seeing, maybe including some of your cancer patients, may not be aware that men and women, in terms of fruits and vegetables, fruits are the blue and vegetables are the red. Men don't even meet 28% of the recommended dietary intakes of fruits and less than 20% of the vegetables. Women do slightly better, but both fruits and vegetables are still below 30%. That means that all of those biochemical active ingredients that are going to support us at the cellular level, at the mitochondrial level, at the boosting of the ATP, at the providing of the vitamins A's, the C's, the E's, the K's, of the antioxidants, and so on and so forth, we're not meeting them. And I will tell you right now that if you ask most people in functional medicine, naturopathic medicine, and people who are looking into dietary food as medicine, they will tell you that the actual recommended dietary intake of fruit and vegetables is actually significantly lower than where it should be. That we should be eating more than what the actual government is recommending us to eat. So this is based off of the recommended dietary intakes that the government is giving us. So if we're not meeting what the government, if the percentage of adults in the United States of America are not meeting what the government is recommending and we have in terms of fruit and vegetables, and the professionals are saying that even that is low, you can see how maybe, this is food for thought, the reason cancer continues to grow despite Nixon's war on cancer is very related to this slide here, our lack of fruits and vegetables, and this next and final slide as well. So here I want you to know what we're looking at. We're looking at the United States of America's food consumption in terms of percentage of calories. So I think, again, this is food for thought, that if you look at the big, vast, large yellow in the middle of this slide, right, the 63% of the United States food consumption is coming from where in percentage of calorie? Processed foods, sugars, refined grains, the fats that we shouldn't be eating, and the oils that we shouldn't be eating. Problem with oils is that if we consume a lot of oils, even the good oils, like olive oil and whatnot, these oils, if they sit on shelves for long enough, they could be rancid, and this rancidity, when we consume them, could end up damaging the cells at the mitochondrial level, at the cellular level, at the tissue level, because of the antioxidants, of the oxidative stress that they can put about for us. But back to that 63, the big elephant in the room. I think that big yellow processed foods, especially sugars and refined grains, it directly correlates to the levels of cancer and of chronic diseases, cardiovascular, stroke, ischemic, CVD, CAD, coronary artery disease, MI, myocardial infarction. You get the point. Peripheral vascular disease, peripheral arterial disease, right? Plaque buildup. As a response to all of these cardiovascular diseases that we've been talking about, peripheral arterial disease, plaque buildup, and so on, the plaque is building up in response to damage to the endothelial artery, period. I think that we could relate this to this chart right here and the previous chart. I mean, we're not even making 30% of fruits and vegetables, and we're not making 30% of the dietary recommended, the government dietary suggestion of fruits and vegetables. So you go figure. If that previous slide and this slide don't ring a bell as to why perhaps we are indeed not meeting why a lot of these chronic conditions are happening, including cancer and cardiovascular, and why perhaps at the endothelial level damage is happening. Look at this slide and look at the previous slide. We are not we're consuming synthetics. We're consuming plastics. We're consuming not only dead products, but products that we don't know how they're harming us, genetically modified. I'm not anti-genetically modified. I'm just saying as long as we don't, I'm one of those who, who says if we don't have proof that they're safe, should we be putting it out to the people in the public to eating? I say no. When I buy things that are in a package, I try to make sure that they're non-GMO and support that. Now, look at the plant food right there. Fruits, nuts, seeds, fiber. 12% of the U.S. food consumption is plant food. That green should be 63%, and processed foods shouldn't even be 12%. They should be eliminated. And so one last thing, and then I'm done here, that I'd like to say, two last things. One is with processed foods, when we talk to our patients, how do we educate them? On the previous slides and on this slide, how do we educate our patients? We're healthcare professionals that are going to be having multiple, if not thousands of conversations when we discharge our patients, when we work in the hospital with them, when they come in because they had a heart attack, a stroke, or they have cancer. This conversation is going to happen. How do we talk to them? Well, I guarantee you that if 63% of U.S. food consumption is in the processed food area, that means that your patient is going up the aisle, down the aisle, up the aisle, down the aisle. They are aisle shopping. They're not going around to the vegetables, going around to the fruits, maybe going around to where there's some, some beets, the salad bar, going around to where there's some olives, and then coming around and then just going to the paycheck at the counter and leave. Maybe they'll go up an aisle because they need to get some real pure kosher perhaps, or even flaked mineral salts, not table salt. Maybe they need to get some extra virgin olive oil. So maybe we'll go for that. But if they're buying their foods in a box, that's on a shelf, that's in a box, that's in a can, that's in a jar, that's in a container, that's in a bag. The companies have to produce these products to be able to have long shelf life. And we don't know what those ingredients do to us. They could be producing cancer. They could be, but basically they're processed foods that are not live, they're not whole. They're processed, they're in a bag, they're in a can. And so we need to try to educate our patients to, one, as the previous slide told us, increase fruits and vegetables. Two, on this slide, increase the amount of plant foods by at least the same amount of processed foods that we or our patients tend to consume, right? So at least try to change that 63 to that 12%. And in terms of animal food, a lot of people say that we should eat mostly plant-based. That's the healthiest way to go. That's generally speaking the Mediterranean diet, generally speaking a DASH diet. It's minimal animal, mostly plant food. And what I would say with, and this is my last and final point, with the animal food, I will tell you right now that if you do consume meat, dairy, eggs, fish, or seafood, make sure it's not corporate meat or corporate dairy or corporate eggs, corporate fish, corporate seafood. When you educate your patient, what does that mean? It means if we are buying our meat and our dairy, our eggs, our fish, and our seafood from Costco, from Raley's, from Safeway, the likelihood of us buying meat that is full of antibiotics, hormones, and so on and so forth is pretty high. So try to support local or stores that buy locally, buy from small farms. One of the reasons why I say avoid corporate meat, eggs, dairy, fish, and seafood is because if you buy from, especially meat and dairy, from large farms that have 1,000, 10,000, 20,000 cattle head, by state and federal law, they have to be giving them hormones. They have to be giving them antibiotics, because if they have no room to grow and they're just standing in a pile of defecation, stool, and they can't move, the likelihood and the risk for infection is really high. So there's no way that they can get around that. The only way to get around that is small farms that don't have to abide by the antibiotic or the anti-hormone, and you can actually hopefully even maybe know where the farm is, go to the website, support them, and what you end up doing is you're buying a product that is a lot healthier, that doesn't have hormones, pesticides, you name it. And with eggs, if it says cage-free, that means absolutely nothing. Those chickens could be so big, so fat, but as long as the building they're living in has a hole or a door where they could technically escape from, but maybe they're unable to because of their condition, they can label it cage-free eggs. We need to tell our patients that cage-free eggs are not as good as pasture-raised chickens, because the eggs that we're going to get from pasture raised are from animals that have been out under the sun. They're significantly healthier. And so again, I tell you right now, where I live in Contra Costa, in Solano County, I can take you to 4 places. You could come in with my car with me right now, and I could drive you to 4 places where you could drop money in a box and pick up eggs, and you can see how the eggs are living. You can visualize them. I say that as our culture moves forward, for us to improve with chronic disease, cardiovascular, including cancer, if we're going to be consuming meat and dairy, try to support the stores that buy from local farms, or we go directly to local farms. And we live in the Bay Area, so it's affordable. And it is possible for people to consume these products that are significantly healthier. And with that said, the last 2 slides really say a lot about a chronic disease, including cancer. We're not getting enough fruits. We're not getting enough vegetables. We're definitely not eating enough plant foods based, and we are a processed food nation. And as a nation that politically upstream, we can't lower that down. Well, you know what? We're going to be tiny little soldiers going out there, and we're going to have this conversation with every single patient that we have that don't abide necessarily by what they're telling us or by eating all these processed foods. And again, sugars, if you didn't get that point about that PET where we give sugar, and wherever it lights up with that radiated sugar is because cancer will gobble all of that sugar up. And how do we know where the cancer is in the body? Because they ate because of the sugar. So if you want to starve cancer, starve that sugar. Starve your body of sugars, at least of the processed sugars, not necessarily the plant-based food sugars. We should be increasing those, but definitely the sugars that are coming from maybe too much consumption of bread, pasta, rice, alcohol if you consume too much, and especially the sugars that are coming from cakes and candies, and all those things that are sitting on the shelf that are big no-nos. And that's it. So I will add this. I will give you 2 links for the cancer lecture because previously one cut off. So this is just a little addendum to that. Thanks for listening.